Check out any news media, and you'll be told COVID cases are soaring and hospitals are packed. And if you're not careful, you could easily come to the conclusion that the pandemic is worse than ever. Indeed, worse than the peak we had last spring in the Northern Hemisphere. But let's take a closer look at the figures and see if we can answer the question, how bad is it? Let's start by looking at a graph, the kind that usually accompanies an article saying that cases are soaring. This is a graph showing the total cases in the United States as a whole. If you just took a quick look at this graph, you might think that the pandemic is worse than ever in the United States. But is that really true? Here's a graph showing the total number of COVID tests performed in the United States on every day since the start of the pandemic. On April 21st, in the middle of the spring peak, there were about 167,000 tests performed in the United States. On December 16th, there were about 1,791,000 tests performed in the United States. That's more than a tenfold increase. So given that testing has increased by more than 10 times, can we use case numbers as a reasonable basis for comparing the spring peak and the present peak in the pandemic? Obviously, we can't. Let me make an analogy. Say you were the chief of a highway patrol unit, and you wanted to find out how many drug smugglers were traveling on your roads. We can represent cars smuggling drugs with red dots in this figure, and we can assign an officer to stop some of these cars and search them for drugs. In effect, he would be testing the cars for drugs. Let's say on one day, he stops 12 cars, and he finds 2 people smuggling drugs. And then a few months later, he stops 39 cars and finds 4 people smuggling drugs. Would it make sense to conclude that the number of drug smugglers has doubled on the roads? That cases of drug smuggling are soaring on your roads? Obviously, we can see the absurdity of this conclusion. All we've done is increase the number of cars that we're testing for drugs. And yet this is precisely what we're doing when we look at graphs of case counts and conclude that the pandemic is worse than ever. It's essential to understand that in the early days of the pandemic, most of the people who were tested for COVID were those who presented at emergency rooms complaining of severe respiratory symptoms. These are the people who made up the 0.3% of the people who died from COVID and the few percent of people who had severe cases of COVID. In essence, testing only revealed the very tip of the COVID iceberg. The vast majority of asymptomatic or mildly symptomatic cases went completely uncounted. Now, mass testing of COVID is available, and people get tested for all kinds of reasons. Maybe they came into contact with someone who had COVID. Maybe they need it for work. Maybe they need a test in order to travel. Maybe they're just curious to see if they've been infected by the virus. And what we're doing is we're revealing more and more of the COVID iceberg, more of those asymptomatic and mildly symptomatic cases. And it's crucial to remember that those cases existed in the spring, only they weren't counted, because at that time, only the sickest people were tested for COVID. But there is one metric that accurately captures the extent of the pandemic, and that's mortality. Sure, a few people might die at home and their deaths might be recorded as something else, but the vast majority of people who die of COVID would be listed in the records as having died of COVID. And since we know that the infection fatality rate, or IFR, of COVID, as calculated by the World Health Organization, is about 0.3%, or 3 in 1,000, we can reverse engineer the amount of people who were infected by COVID but did not die, and thereby arrive at the true total number of cases at any time. Here's a simple formula you can use to calculate the total cases of COVID from the number of deaths from COVID. Deaths equal cases times IFR, and 0.3% is 0.003 expressed as a decimal. Suppose 100 people had died from COVID on a particular day. You'd write the equation like this. And to solve it, you'd simply have to divide the number of deaths by the IFR, and that would give you the total number of cases that had existed on that particular day. In this case, 33,333. So if you wanted to see the true extent of the pandemic in your country over time, you'd have to look at a graph of the deaths per day and then calculate from those deaths to find out how many cases existed on each of those days. I did that for the United States figures at the end of October, and here's what the result looks like, with deaths and cases graphed together with a logarithmic scale. If you put them together on the same graph with a linear scale, it becomes absurd because cases vastly outnumber deaths. Of course, you don't really have to do any math to figure out how the pandemic is going. Just look at a graph of deaths, and that will tell you if things are getting better or worse. And if you want to convert the whole graph into a cases graph, simply multiply the numbers on the vertical axis by 333. Now you might say, looking at this graph, that the situation still looks pretty bad. But keep in mind, this is a graph representing all the deaths in the entire United States. And it includes places that have already gone through their first wave and places that are in the middle of their first wave. And you get an idea for that by watching how the virus spread from coastal cities in the United States to country areas like Montana and Wyoming. If you want to get an idea how the pandemic is going in your area, you need data for your area. For example, here's a graph of daily COVID deaths in New York City, which had a very bad first wave in the spring, but which is now suffering far fewer deaths than places like California. I'll admit, there are some factors that confound the attempt to calculate total cases from deaths. In some places, the most vulnerable people have already died of COVID. That would reduce the infection fatality rate. Likewise, it's clear that treatments for COVID are improving. That would also drop the infection fatality rate. And finally, it's possible that the virulence of the virus is decreasing. But it's highly unlikely that any one of these things has changed the IFR by more than a few tenths of 1%. And that's a very small change compared to a tenfold increase in testing. The only way we could get a really accurate picture of changes in the pandemic over time would be to test large numbers of people randomly selected from the population using identical testing methodologies, equipment, and standards. Given that no such testing is being performed, the closest we can come to accurately estimating the trends in the pandemic is by looking at death rates and extrapolating total cases from there. Now, there are those who will say that positivity rates will give us an accurate picture of what's going on in the pandemic. And perhaps they do give a better picture than just raw case numbers, but they are victim to all kinds of selection biases. But anyway, here's the positivity rate for the United States as a whole since the start of the pandemic. You can see that positivity rates have dropped significantly since the spring peak of the pandemic. But once again, it doesn't make much sense to look at the data for an entire country, especially a large country like the United States. You should look at the most local data you can find. For example, here's the positivity rate for New York City, where the positivity rate has plummeted since the start of the pandemic. And yet, despite the fact that the pandemic is clearly much less severe now than it was in the spring, the media insist on painting a very dire picture. London is a great example. Here are a few headlines from the English media. But just like in the United States, testing has increased dramatically in the UK, by about a factor of 4 since the spring. What's interesting is that the Greater London Authority, who created that graph, admits that case numbers can't be compared between the spring and the winter because of increases in testing. So if we want to get a real idea of the extent of the pandemic in London, we have to look at daily COVID deaths. And as you can see, the pandemic in London is far less severe than it was in the spring. Why, you might ask then, are the hospitals so full? Well, before you can answer that question, you have to look at how full hospitals in London would normally be during winter months. In 2016, Nuffield Trust, a healthcare think tank in the UK, published this report on winter bed pressures in the National Health Service. They reported that the average occupancy rate for hospital beds was 95% for almost all of the winter, and that a third of hospitals were completely full at least one day during the winter they studied. In New York, the media are painting a similarly dire picture of the pandemic. Here's an article from the New York Times about ICU bed occupancy rates. The article opens to a map of New York City and a list of hospitals in New York showing their ICU bed capacity. If you look closely, you'll see that they've listed the hospitals with the highest ICU bed occupancy first on the list, so that anyone casually reading that article would get the impression that New York City ICUs are overflowing with COVID patients. But if you scroll even a little down that list, you'll see that most hospitals in New York have plenty of ICU bed space. And the ICUs in New York City are on average only 62% occupied. Fortunately, there are some places in the world where the media and the government are not trying to instill fear and panic in their populations. One such place is the province of British Columbia in Canada. At a recent press conference, Provincial Health Minister Adrian Dix made the following revealing statement. Right now, our hospital capacity is about 88%. Normally it's over 100% this time of year. So in other words, we have more capacity than we have normally in our hospital system. If only more government officials could be so honest with their citizens. So to answer the question I posed at the beginning of this video, how bad is it? The answer is almost certainly this. It's not nearly as bad as you are being led to believe by the media and your government. So whenever you are told that case counts are soaring and hospitals are packed, you have to ask yourself some questions. How much has testing increased in your area? How localized are the data you are looking at? And how busy are hospitals normally in your area at this time? But beyond those pragmatic questions, there are some bigger questions you should be asking yourself. Why do the media and the government want to exaggerate the extent of the pandemic and instill fear in people? And more importantly, who gains from making the pandemic seem worse than it actually is?